what it means to be double jointed, what is Ehlers Danlos, the Beighton Scale, and why you should even care about it. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Care right here in beautiful Amarillo, Texas, and we're going to talk today about being stretchy and double jointed. Yes, double jointed. That's what I'm saying. That's what we grew up calling it, right? Most of us have seen at least one of our friends, or maybe you yourself, be able to do stupid human tricks with their bodies. Whether it be turning their elbows the other direction, bending over and putting their hands flat on the floor while their legs are straight. Maybe they can sit with their ankles behind their head, or even turn their fingers in all kinds of different directions. Super stretchy people can be pretty entertaining. Heck, they're even in the circus, in the carnival, Cirque du Soleil, and those things. They're entertaining. What is it, though, that makes them different from the rest of us? And why can some contort their bodies in all kinds of arrangements, while so many of us, like me, struggle to just simply bend over to try to touch our toes? First thing is, it's important that we put the term double jointed to rest. Let's bury that sucker right here and now. Nobody has two joints in one spot, allowing them more flexibility or more movement in that joint. It's just not a thing. It's not reality. This terminology for more movement, it's just incorrect. What is really going on, it all comes down to connective tissue. And what is connective tissue exactly? Well, it's a complex mixture of proteins and other substances that provide strength and elasticity to the underlying structures in your body, according to the Mayo Clinic. The difference is not the makeup of the connective tissue, but more in how the connective tissue is arranged. The most noticeable symptoms of connective tissue disorders are overly flexible joints, stretchy skin, and chronic joint pain, and even fragile skin, making it hard to stitch up a wound sometimes. And the protein affected is called collagen. Now that we have determined there is a connective tissue disorder at play here, then surely it has a name. And guess what? It does indeed. It's called Ehlers Danlos syndrome. If we shorten that up, we'll call it EDS. EDS is an inherited disorder. It runs in families. EDS is simply the umbrella name for several subtypes of EDS. In fact, there are 13 subtypes of EDS, and each subtype is really a distinct disorder that runs just that subtype in just that family. So, how do I, as a clinician, most commonly spot EDS? Well, I treat neuromusculoskeletal issues, and part of assessing a patient is to have them to go through their normal ranges of motion for their neck, their mid-back, low back, and different joints. So it's very common for me to be examining a low back, for example, and to ask a patient to just bend over and touch their toes. And they do it, but they just simply bend right over and they put their hands flat on the floor, or at least come real close to it. And in cases such as that, it's time to pull out the Beighton Scale. I gotta reach into my toolbox and pull out the Beighton Scale. Unfortunately, I'm finding out that not enough medical doctors, osteopaths, chiropractors, nurse practitioners, or physician assistants really know a lot about Ehlers Danlos syndrome, or EDS. And they don't necessarily know the significance and importance of utilizing the Beighton Scale to assess these patients. If the issue is musculoskeletal, being able to recognize and diagnose EDS is vital to the patient's recovery. Otherwise, we could be doing the exact opposite of what we should be doing in order to treat the patient's pain, and we could actually make it worse. So, what is the Beighton Scale, right? Well, the Beighton Scale is used to quantify or put numbers on the severity of EDS by going through some very simple body movements to see how stretchy a person really is. The scale then places a point value on each movement, and it ultimately arrives at a total score by the time you're finished going through the scale. The movements and the point values are as follows. First of all, if you can place your hands flat on the floor while your knees and legs are straight, you get 1 point. If you're able to bring your thumb into flexion and touch it to your wrist, you see I can't do that. If you can do that, you get 1 point per thumb. being able to bring your pinky back about 90 degrees. I can't do that. That's 90 degrees, right? I can't do that. If you can bring your pinky back 90 degrees or so, then you get 1 point per pinky. If you can straighten your elbow beyond 10 degrees beyond straight, then you get 1 point per elbow. And then if you can straighten your knees 10 degrees beyond straight, you get 1 point per knee. So now that's a total of 9 possible points. And most clinicians agree that a score above 4 indicates some sense of hypermobility, and that the higher the score, the more hypermobile a person is, obviously, and the more they may have some interest in getting some genetic testing through their medical professional to further evaluate and determine the exact subtype of EDS that they might have. Now, while there are so many different subtypes, for the most part, they don't really affect your life much outside of the symptoms I mentioned. And of course, outside of all the party tricks that you can show off by contorting your body, which is always entertaining. There is one subtype that can be particularly dangerous that I'll discuss here in just a minute, but hold your shorts on that. But the subtypes mostly just simply mean that you're stretchier than everyone else. Most subtypes, they don't shorten your lifespan or anything like that. However, that doesn't mean that they don't come with some minor issues. 2 of the less severe symptoms that we see most commonly with just a run-of-the-mill EDS patient, 2 of them are early joint degeneration and chronic pain. So to demonstrate, most of us know someone that has had spinal fusion surgery. Most people don't know this, but the surgeons fuse segments of the spine together because there's extra motion in the region, and the thought process is no motion equals no pain. So they fuse or freeze the movement at the segment. Now, spinal surgery comes with its own set of other issues that we'll not get into here, but for that very segment, well, they're correct. Now, if we extrapolate that idea to every joint in the body, then we can reasonably say that stretchy EDS folks, well, they have extra movement in almost every joint of their body. And that can mean a bit of extra wear and tear throughout the years, and can most definitely mean some extra chronic joint pain due to the increased motion in the joint itself and some early degeneration of the joint. Beyond the mostly harmless EDS patients, there is a subtype that is more concerning, is the vascular type of EDS. It is the subtype that clinicians should be especially on the lookout for. It's exceedingly rare. It happens in only about 1 in 250,000 people, but it weakens the blood vessels and makes organs more likely to develop a tear. Obviously, the vascular subtype of EDS needs to be monitored by a medical professional. This more severe type of EDS is obviously more of a concern and more impactful than simply being able to bend over or bend more than other people or developing some chronic pain. It's a lot bigger deal than that. Now, the treatment of just run-of-the-mill hypermobile EDS depends on the signs and the symptoms present in each person. For example, chiropractors that specialize in orthopedics and exercise rehabilitation or physical therapists are often recommended to strengthen muscles and improve joint stability. Assistive devices such as braces, wheelchairs, or scooters may be necessary depending on the severity of the joint instability, but that's exceedingly rare. Most never need anything like that. Chiropractors are well known for spinal manipulative therapy. I call it SMT for short. And this is otherwise, spinal manipulative therapy is otherwise known as just popping bones like you associate with chiropractors. Now, chiropractors use SMT to increase movement in the joints. Well, if a patient has EDS, they already have increased or excess movement in most of their joints. For this reason, consistently using SMT on an EDS patient, it's counterintuitive. We don't need to put more motion into joints that already have more motion, right? As with anything in life, though, there are exceptions to the rule, and SMT can be useful in an EDS patient without a doubt, here and there, mostly when it's used very sparingly. However, As a general rule, EDS patients, they don't typically need to be seen for spinal manipulative therapy several times per week for a long course of treatment. A treatment schedule of spinal manipulative therapy like that can really work in the opposite for an EDS patient and actually worsen their pain or their condition. However, more and more evidence-based chiropractors are now utilizing exercise rehabilitation right here in their offices. Now, exercise rehabilitation, what is that? It's simply the chiropractic profession's term to describe physical therapy without using the term physical therapy, since the term is really owned by the physical therapy profession. So it's a chiropractor's way of saying we do physical therapy type activities. So now that we're clear on the terminology, it's important to understand that joints with extra movement in them, they benefit the most from strengthening and supportive activities. Activities such as weight training, for example. Weight training can build stiffness, support, and strength in joints throughout the body. And when a patient can stiffen the joints through activities like this, well, they can decrease the movement in each joint. As the movement is decreased, so is the wear, and so is the chronic pain. At the end of the day, as a chiropractor, I can only tell you where you score on the Beighton Scale, and I can educate you on Ehlers Danlos syndrome. To really explore EDS and a specific subtype, a patient really needs to consult with a geneticist, because EDS is a genetic disorder, and they are most able to, they're the professional that is most able to classify the subtype and do the necessary testing that an EDS patient might need. Now, for the most part, EDS isn't going to affect your life or your livelihood. This isn't meant to scare you or anybody else. It is only meant to educate on a topic most simply just don't think about or they just don't know much about. They just know they're stretchy. Education is how we should proceed and how we improve our patients' lives. And with the right diagnosis and the right treatment, EDS patients do very, very well and can live their lives fairly unaffected for the most part. Now, to learn more, please visit www.elhers-danlos.com or the Mayo Clinic's website on EDS. It's all very informative. Now, that's it for this week. Thank you so much for watching this video. I hope I helped give you some clarity on all of this double-jointed stuff. Every week I have great information to share with you, so if you're watching this on YouTube, I'd ask you to smash that subscribe button underneath the video there so you won't miss any important information. If you're on Facebook or YouTube, do us a big favor and share this information with your people. It may really help someone you love or that you care about. Again, I'm Dr. Jeff Williams. Until next week, take good care of yourself and your family, and we'll see you then.